Welcome to our comprehensive exploration of artificial intelligence in panoramic radiography. Dental panoramic radiographs, or DPRs, are essential tools in oral health assessment, offering a broad view of dental and maxillofacial structures. However, interpreting these images presents challenges due to overlapping anatomy and geometric distortions. Recent advances in AI, especially deep learning, have transformed how clinicians approach these images, promising faster and more consistent diagnostics. In this video, we'll journey through the principles, applications, performance, and ethical considerations of AI in dental radiology, highlighting both its transformative potential and the hurdles that remain. Let's begin by understanding the fundamentals of panoramic radiography. Panoramic radiography, often called an orthopantomogram or OPG, is an extraoral imaging technique that captures the entire jaw region in a single image. Unlike intraoral X-rays, OPGs use a rotating X-ray tube and sensor to scan the patient's head, creating a comprehensive view of teeth, jaws, and surrounding structures. The focal trough, a curved zone matching jaw shape, ensures sharp imaging for structures within it, while those outside appear blurred or distorted. This technique is invaluable for treatment planning, especially for patients unable to tolerate intraoral imaging. However, its limitations include lower spatial resolution and non-uniform magnification, making it less reliable for detecting subtle pathologies. Panoramic radiographs are prone to three types of artifacts: real images, double images, and ghost images. Real images represent true anatomical locations. Double images occur when midline structures are scanned twice, and ghost images arise from dense objects outside the focal trough, appearing blurred and magnified on the opposite side. Understanding these artifacts is crucial for accurate interpretation, as they can mimic or obscure pathology. Common causes include jewelry, the hyoid bone, or the cervical spine. Clinicians must distinguish these artifacts from genuine findings to avoid misdiagnosis and ensure effective treatment planning. Panoramic radiographs offer broad anatomical coverage, making them ideal for initial assessments and treatment planning. They are especially useful for patients with trismus, severe gag reflexes, or those unable to tolerate intraoral imaging. However, OPGs have technical limitations: lower spatial resolution, non-uniform magnification, and the flattening of 3D structures into 2D images. These factors can obscure critical details, such as early caries or bone loss, and necessitate follow-up imaging like cone beam CT for complex cases. Proper patient positioning is essential to maximize diagnostic value and minimize artifacts. Manual interpretation of panoramic radiographs is fraught with challenges. Anatomical ghosting and superimposition can confuse even experienced clinicians, leading to missed or misdiagnosed pathologies. Cognitive biases, such as satisfaction of search, cause practitioners to overlook secondary issues once a major finding is detected. Interobserver variability is high, with disagreements on boundaries and early lesions. The clinical volume crisis, with practitioners reviewing dozens of OPGs daily, increases visual fatigue and error rates. These limitations underscore the need for assistive technologies to enhance diagnostic accuracy and consistency. Artificial intelligence offers solutions to many challenges in panoramic radiography. By leveraging convolutional neural networks, AI can automate object detection, tooth numbering, and pathology identification. It provides rapid, consistent analysis, reducing the risk of misdiagnoses due to fatigue or bias. AI also enhances patient communication by overlaying color-coded findings on radiographs, making complex information accessible and boosting treatment acceptance. The rationale for AI adoption is not just technical, but behavioral, transforming subjective recommendations into objective, evidence-based consultations. AI in dental radiology marks a shift from subjective interpretation to data-driven decision support. By analyzing large datasets, AI systems identify subtle patterns and landmarks that may be missed during routine exams. The FDA has cleared over 115 radiology AI algorithms, with dental imaging software increasingly recognized as medical devices. Deep learning, especially convolutional neural networks, forms the backbone of these systems, enabling tasks like early caries detection, bone density assessment, and anatomical landmark recognition. AI is revolutionizing workflows, improving accuracy, and reducing interpretation time. Dental AI platforms primarily use deep learning architectures inspired by the human brain. Convolutional neural networks, CNNs, process image pixels to identify features like edges, textures, and shapes, excelling at tasks such as caries detection and bone loss evaluation. Recurrent neural networks, RNNs, handle sequential data, tracking disease progression and treatment outcomes over time. Advanced algorithms segment 3D cone beam CT datasets, isolating anatomical structures for surgical planning. These architectures underpin the diverse clinical applications of AI in dental radiology. AI systems are applied across multiple dental imaging modalities, including intraoral, panoramic, cephalometric, and CBCT scans. They detect pathologies like caries, periapical lesions, and calculus, automate bone-level measurements for periodontal assessment, and assist in orthodontic planning. AI also supports surgical workflows, mapping nerve canals and planning implants, and automates charting by numbering teeth and identifying restorations. These applications streamline diagnostics, improve treatment planning, and enhance patient outcomes. Recent studies show substantial improvements in diagnostic performance with AI integration. AI-assisted clinicians achieve higher disease detection rates, with reports indicating a 37% increase compared to unaided interpretation. Sensitivity and specificity values often exceed 90%, and tooth-level accuracy ranges from 94.9% to 99.9%. However, achieving perfect patient-level diagnostic matches remains challenging, highlighting the need for continued human oversight. These metrics underscore AI's value as a powerful assistive tool in dental radiology. Several AI platforms have received regulatory approval and are integrated into clinical practice. Pearl Second Opinion focuses on radiographic lesion detection, Overjet specializes in quantitative periodontal analysis, Diagnocat offers CBCT segmentation for surgical planning, and Orca Dental AI automates orthodontic workflows. These platforms exemplify the growing adoption of AI in dental radiology, providing clinicians with robust tools for diagnosis, planning, and communication. Despite progress, AI systems face technical limitations. Data bias and lack of standardization can reduce accuracy across different clinical settings. The black box problem means internal decision-making is often opaque, requiring clinicians to validate AI findings. Metallic restorations and implants can cause image artifacts, distorting results and increasing false positives. Addressing these challenges is essential for reliable, safe AI deployment in dental radiology. Modern dental AI platforms operate through cloud-based subscription models. Costs vary based on clinical volume and software capabilities, ranging from $200, $400 for basic 2D analysis to $700, $900 for advanced CBCT and surgical modules. Economic factors influence adoption, requiring practices to balance investment with workflow benefits and diagnostic improvements. Understanding these costs is crucial for informed decision-making in clinical integration. AI interpretation of panoramic radiographs involves a multi-tiered pipeline. First, object detection frameworks like YOLOv8 or MaskRCNN identify teeth and jaw regions. Next, Semantic segmentation models such as UNet classify pixels into enamel, dentin, bone, or pathology. Contextual filtering, often using RNNs, refines outputs by filtering artifacts. Synthetic fusion data guardrails train models on balanced datasets, reducing errors from poor image quality or hardware differences. This pipeline enables robust, automated analysis of complex panoramic images. AI autonomously detects critical landmarks and pathologies in panoramic radiographs. For periodontitis, it measures the distance between the cemento-enamel junction and alveolar bone crest, quantifying bone loss and classifying it as horizontal or vertical. It traces the mandibular canal for surgical planning, alerting clinicians to nerve proximity risks. AI also flags caries and periapical lesions by identifying subtle radiolucencies, achieving high diagnostic accuracy. These capabilities streamline diagnosis and enhance patient safety. One of AI's fundamental tasks in dental imaging is accurate teeth identification and numbering. Deep learning models achieve up to 97% accuracy in segmentation and numbering, automating, charting, and streamlining workflows. This capability is vital for creating digital dental records and ensuring consistent diagnostic processes. Automated charting reduces manual workload and minimizes errors, supporting efficient patient management. AI excels at detecting dental and periodontal diseases. For caries, models achieve around 91.5% accuracy, enhancing detection of advanced lesions. Periodontal bone loss is quantified with remarkable precision, with some models reaching 98% accuracy and 100% sensitivity. Periapical lesions are identified with high sensitivity and specificity, supporting endodontic diagnosis. These capabilities provide faster, more objective alternatives to manual measurements, improving diagnostic consistency. AI platforms like Diagnocat are evaluated for their ability to detect dental treatments such as missing teeth, crowns, pontics, fillings, and endodontic procedures. Tooth-level detection accuracy is near perfect for missing teeth, crowns, and pontics, but challenges remain with fillings and endodontic treatments due to superimposed structures. These features are essential for treatment planning and forensic identification, highlighting AI's role in comprehensive dental care. Panoramic radiographs capture more than just dental structures. AI assists in screening for systemic conditions like osteoporosis, maxillary sinusitis, and carotid artery calcifications. Models achieve high accuracy in identifying osteoporotic changes and sinus opacities, and are being developed to detect carotid plaques, which are risk indicators for cerebrovascular events. This broadens the clinical utility of panoramic radiographs beyond dentistry. AI integration significantly enhances workflow efficiency by automating dental chart generation and structured reporting. Clinicians can focus more on patient communication and treatment planning, while AI serves as a reliable second opinion, mitigating human error from fatigue or inexperience. This improves diagnostic consistency and streamlines clinical operations, supporting better patient outcomes. While AI platforms demonstrate high accuracy at the individual tooth level, generating a completely error-free full-mouth report remains challenging. Studies show only 56.5% perfect match at the patient level, with most errors in fillings and endodontic treatments, especially in posterior regions. This gap highlights the need for human oversight and continued refinement of AI models for comprehensive diagnostic reliability. Meta-analyses reveal that AI models often achieve diagnostic accuracy exceeding 95% for specific tasks. In some cases, AI demonstrates superior sensitivity compared to human clinicians, such as in fracture detection or lung cancer screening. However, generative AI models show more nuanced performance, sometimes matching non-expert physicians but falling short of expert standards. These metrics guide the ongoing development and validation of AI tools. The integration of AI into clinical practice introduces complex dynamics. AI assistants can improve performance for some clinicians, but may interfere or worsen accuracy for others. Factors like experience or subspecialty do not reliably predict benefit. The quality of the AI tool is critical. High-quality AI boosts performance, while poor AI can diminish accuracy. Personalized assistive systems are needed for optimal collaboration. AI products in radiology are evolving, with most tools certified under moderate-risk medical device standards. Despite rapid research advancements, evidence for effectiveness in real-world settings is limited. AI reduces interpretation times and improves workflow efficiency, but challenges like false positives and black box decision-making persist. Trends for 2024-2025 emphasize multimodal and explainable AI to enhance clinical insight and trust. Comparing AI to human radiologists reveals strengths and limitations. AI excels in speed and sensitivity, processing vast volumes without fatigue and detecting subtle patterns. However, humans outperform AI in specificity, contextual synthesis, and handling complex cases with multiple findings. Human interpretation integrates clinical history and prior exams, while AI evaluates images in isolation. Consistency is higher with AI, but variability remains in human readers. AI tools can introduce automation bias, where clinicians over-rely on algorithmic predictions or undervalue AI input. Poorly performing AI can actively diminish diagnostic accuracy, highlighting the need for rigorous validation before clinical deployment. The interaction between AI and human clinicians is not uniformly beneficial, requiring careful integration and ongoing evaluation to ensure optimal outcomes. AI technologies, including machine learning, natural language processing, and deep learning, have revolutionized clinical decision support systems, CDSS. These systems learn from data, recognize patterns, and provide actionable insights, enhancing diagnostic accuracy and personalized care. AI can be integrated throughout the radiology workflow, supporting study ordering, pre-processing, acquisition, post-processing, reporting, and storage. AI can be integrated at nearly every stage of the radiology workflow, from study ordering to reporting and storage. Packaging AI solutions involves considerations of performance, data flow, and security. Orchestration engines coordinate multiple AI models, manage data routing, and ensure compliance. Interoperability standards like DICOM and HL7 enable seamless information exchange across healthcare systems, supporting scalable AI integration. Integrating AI into clinical systems requires robust computational infrastructure, scalable GPU clusters, and cloud computing. Development environments must support rapid prototyping and interdisciplinary collaboration. Efficient integration with PACS and EHR systems is critical, but proprietary formats and lack of open tools pose challenges. Orchestration engines manage data routing, and continuous monitoring ensures safe, effective performance in clinical practice. Operational challenges include strategic planning, staff education, and managing radiologists' workloads. Variable adoption of standards and multiple AI result formats create workflow complexity. Clinical challenges involve balancing AI-generated information with radiologist expertise, regulatory hurdles for device clearance, and ethical considerations. Ensuring AI technologies are clinically valid and ethically sound is paramount for successful integration. AI algorithms require vast amounts of high-quality, annotated data for training and validation. Acquiring such data is labor-intensive, often suffering from poor label quality and domain shift. The black box nature of deep learning models limits explainability, posing barriers to clinical trust and patient safety. Methodological instability and poor reproducibility in real-world settings highlight the need for robust, diverse datasets and explainable AI solutions. AI development is susceptible to data bias and algorithmic fairness issues. Training data often overrepresents positive findings, leading to overfitting and biased behavior. Lack of diversity in datasets can result in poor performance for underrepresented groups, exacerbating healthcare inequalities. Addressing these concerns is essential for equitable AI deployment and protecting patient welfare. AI development requires access to sensitive patient imaging data, raising privacy and ownership concerns. Regulations like GDPR mandate explicit consent and true anonymization, but medical images are inherently rich in identifiable features. Commercialization of AI tools built on private data sparks ethical debates about profit sharing and patient rights. Ensuring robust data governance is critical for ethical AI deployment. Integrating AI into radiology practice faces logistical and human-centric challenges. Resistance to change and lack of trust among radiologists stem from algorithm opacity and fears of workforce disruption. Infrastructure and integration costs are substantial, especially in low and middle-income countries. Accountability and legal liability for erroneous AI use remain unresolved, requiring clear governance frameworks. The ethical landscape of AI in radiography revolves around beneficence, non-maleficence, autonomy, and justice. Algorithmic bias can perpetuate healthcare disparities, violating justice. Transparency and explainability are critical for maintaining trust and accountability. AI should augment, not replace, radiologists, preserving professional autonomy and the radiologist-patient relationship. Ethical deployment requires continuous monitoring and diverse training data sets. The legal framework for AI in healthcare is evolving. Assigning liability for AI-related errors is complex, involving radiologists, institutions, IT departments, and vendors. Regulatory oversight, such as FDA clearance, emphasizes rigorous clinical validation. The dynamic nature of machine learning challenges traditional regulatory paradigms, requiring adaptable pathways for patient safety and innovation. The legal standard of care may shift as AI adoption increases. Data is central to AI development, intersecting with stringent privacy rights and regulations. Consent and data ownership are critical, with frameworks like GDPR and HIPAA mandating patient control. True anonymization is difficult, as images contain identifiable features. Emerging privacy risks require mitigation strategies like federated learning, differential privacy, and continuous security audits to protect patient information. The future of AI in radiography moves toward predictive and preventive analytics. AI models will analyze longitudinal imaging data to identify markers of disease progression before symptoms appear. This shift enables early intervention and personalized care, transforming diagnostic imaging from reactive to proactive medicine. AI will optimize scanner parameters in real time, reducing radiation dose while maintaining image quality. Intelligent triage systems will prioritize critical cases, streamlining radiology work lists and improving workflow efficiency. Automated acquisition and workflow optimization are key to maximizing the benefits of AI in clinical practice. The next frontier is radiogenomics, integrating radiologic imaging with genomic, proteomic, and clinical data. This fusion enables highly personalized precision diagnostics and treatment response predictions, advancing the field toward individualized medicine and improved patient outcomes. Future AI systems must provide logical explanations for their findings, bridging the gap between black box models and clinical accountability. Explainable AI, XAI, enhances trust among practitioners, enabling clinicians to understand and verify diagnostic outputs. Heat maps and transparent reasoning will support informed decision-making and foster acceptance of AI in clinical workflows. AI-driven natural language generation will assist radiologists by drafting preliminary structured reports. This automation allows clinicians to focus on complex interpretation rather than manual transcription, improving efficiency and reducing administrative burden. Automated reporting is a key step towards seamless integration of AI in clinical practice. AI is unlikely to replace human clinicians, but will serve as a powerful adjunct, enhancing efficiency and precision in decision-making. The future of dental radiology lies in synergistic relationships, where AI supports clinicians in diagnosis, treatment planning, and patient communication. Ongoing research and integration efforts will focus on seamless software adoption, longitudinal validation, and international standards. Future research must prioritize seamless integration of AI within electronic health records, longitudinal validation studies, and the establishment of international standards for data sharing and model evaluation. These efforts are essential to fully realize the clinical potential of AI in panoramic radiography and ensure safe, effective, and equitable deployment across diverse healthcare settings. Artificial intelligence is reshaping dental radiology, particularly in panoramic imaging. AI-based tools automate detection, segmentation, and classification of dental pathologies, matching or exceeding clinician performance in many areas. While challenges remain such as data quality, explainability, and ethical concerns, the synergistic integration of AI and human expertise promises a future of enhanced diagnostic precision and workflow efficiency. Continued research, regulatory development, and ethical vigilance will guide the responsible adoption of AI in dental radiology.